right. Hi there, everyone. This is Julia and Marissa Bagg with Moms to the Mic. So glad you are with us once again for a live Facebook chat.
Yeah, today we're going to be talking about the upcoming holidays, getting together with our families in the middle of a global pandemic that has stretched on now probably for a lot longer than people were expecting. So we definitely wanted to talk with you all, see how you're feeling, how you're planning your holidays, and share some insights that we have, some best practices from a pediatrician as well as a family therapist, just to try to be as safe as we can be, but still celebrate to some extent the Thanksgiving and Christmas holidays, right, Jules?
Absolutely. So let's go ahead and introduce our guests to you. First, we have Dr. Elizabeth Steinberg, who is a board-certified pediatrician with Broward Health. To talk about the medical side of this, thank you so much for joining us, Dr. Steinberg.
Thanks for having me. I love this platform.
Thank you.
And fellow mom. And then we also want to introduce to you licensed marriage and family therapist. There she is, Monica Schneider, who is joining us from Wellspring Counseling in Miami. So thank you so much, ladies. We're all moms, and now we're sharing the mic, and we're all making Thanksgiving plans. You know, Marissa and I were just talking about how we're going to handle this, and maybe Dr. Steinberg, do you want to start off with, some of the safety considerations, where things stand now, when it comes to being safe with COVID-19 and family gatherings?
Yeah, so in South Florida right now, the cases are rising, and we're not really quite where we were back over the summer between July and August, but we are rising, and the cases are rising, and the deaths are expected to lag behind. We're not sure anything about the virus, if it's going to have the same impact, is it going to be a lower peak than we had over the summer? But with that in mind and what we witnessed over the summer, I think it's reasonable to kind of take it back a little bit and celebrate the holiday in a way of prevention more than to avoid the spread of the illness and COVID.
So tell us. Yeah. Oh, sorry, Joel, go ahead.
No, go ahead, Marissa.
I was going to say, I'm sure, Dr. Steinberg, this is something that you talk with some of your patients and your clients about. What are you telling them if they come in today and say, should I be spending time, with family? Should people be coming in from out of town if they want to, for Thanksgiving? How do you kind of, advise them in that situation?
So I follow the CDC guidelines as well as healthychildren.org. It's a free website for parents and pediatricians to use to help navigate these concerns, because it's very important to me to advocate as a pediatrician the idea of the American Academy of Pediatrics, but each family is very different and each concerns are very different. So I kind of use this guide, and they have one listed for Thanksgiving for families who are either low risk, so they could do a little bit more with people, and those who are high risk and need to be much more careful.
So can you talk a little bit about that high risk and low risk, what that means?
Yeah, so the safest thing to do this year really is to celebrate Thanksgiving holiday with your immediate household. So that would be whoever is living inside that household being together. And if you can see your family virtually, that would be ideal. As well as some other things that are kind of fun, which would be to celebrate with family and neighbors, which I think is actually even another issue with Thanksgiving. It's not the actual holiday itself, because a lot of people do have an intimate Thanksgiving that actual day, but it's like the little parties beforehand that we want to share and experience the holiday with that upcoming week, which are also kind of dangerous too, if you think about those gatherings. So you could do a drop off. You could take a dish or some sort of meal, and you could bring it to somebody's house, leave it on their doorstep to minimize the spread. And then also I thought was a really cute idea that was recommended was to do grocery shopping, especially for the elderly or immunocompromised. sharing ideas leading up to Thanksgiving about what you're making and how you're preparing it. Me and my sisters do this every year anyway, but that's something kind of to bring that life to the holiday. And these are all activities to do in the low risk prevention category.
So it's really like we're thinking about the holiday kind of in an entirely different way, really, because usually, you may have people coming in, and even just dealing with, obviously the safest thing I get is sticking to your own household. So what about, that is going to lead to some difficult conversations. And that's where I think we want to bring in Monica. Those are hard conversations. And Marissa and I were just talking about that this morning.
Yeah, they really are, because at the end of the day, everybody is highly charged right now. We were talking a minute ago about even just this fatigue of COVID, like this idea that we're really tired of being in lockdown. We're tired of the isolation. And this is one of the first holidays that we could actually get together, so to speak. And so it's a lot easier just for everybody to say, oh, but let's just go, or let's just come. And people aren't feeling comfortable in some situations. So I think it's really important that we all have our expectations of what this holiday is going to look like. And then for those who usually get together in a group, that there's even like a pre-Thanksgiving phone call. We actually did that with my family, where we sat down and we talked through what we expect for the next couple weeks, how we're going to handle getting together, testing, masks, are we going to sit inside, are we going to sit outside, all of those different things. And that really does help to do that ahead of time, because it also allows for people to adjust their expectations over the next week and be able to meet people where they are.
And what happens when you're not on the same page? I think that's one of the big concerns.
It is. That's a really hard one. The hard thing at that one is that I think you have to be the bigger person. We all have struggled throughout this pandemic in different ways, whether it's financially, whether it's loss of life, loss of income, loss of, experiences for even those seniors who maybe didn't get to do graduation the way they expected. And so it's partly our responsibilities, each of us, to be able to sit and notice how we're feeling and our expectations, and then to see ourselves in the other person's shoes. And so to understand where they're coming from, to understand what they may have experienced, and to understand that we may not even realize everything that they have experienced over the last couple of months. And so with that, to be able to set aside some of those differences and those grievances, maybe journal about them, take a walk, and if you're spiritual, be able to pray, all those different things, call a friend and talk it through, or things like that. But to be the bigger person, because you're right, not everybody is going to be able to do that in this situation.
So let's say, Monica, that a family has, actually both of you could answer this, a family has decided to, extend it a little bit beyond their immediate family and maybe have, an aunt or an uncle or a grandparent come. What are some of the best practices, right? If they are having people outside the household come over, I imagine, still keeping that number small, maybe doing it outside, wearing masks, things like, what would you suggest people do if they're comfortable enough to invite a few people over to the house?
Yeah, so I think the most important thing is to know your risks of the people that you're with. And a lot of times in these relationships, you've probably been hanging out with them anyway in your own little bubble, if you will, leading up to this over the past couple of months. So the best thing is to kind of repeat what Monica said earlier, was have like a pre-screening phone call, discuss what you're going to do as a group. Of course, if anybody is having any symptoms, or they felt a little weak or the day before, or whatever the symptoms are, kind of have a pre-screening before the actual day and make sure everybody's on the same page of what the expectations are. Keeping the gathering short, maybe shorter than usual, and also smaller than usual. Maybe you would have had someone come over for dessert last year. Maybe just keep it to that 2-family gathering this year instead. And wearing masks when possible, if you are not eating or drinking. Similar to what we do in a restaurant, we wear our masks in those situations. And then also, if you can, which we can in South Florida, is eat outside if it's possible, and also use paper utensils. Maybe not bring out the nice utensils this year, the plates, and using paper, plastic utensils. Eating outside. I saw a really cute idea was maybe experiment with grilling this year, the turkey, or using a turkey fryer. And of course, be careful. Keep in mind fire and burn prevention at all times, but this may be the year to do something different with your actual meal. And also, I thought another idea was great, having one person serve instead of everybody kind of grab and go, but having one person serve everybody, also to minimize the touching.
And I just want to bring out one of our viewers here who's watching, Yvonne Fernandez Samaru, saying get tested before and have dinner outside. So just kind of the same, along the same lines that you're saying, Dr. Steinberg. But I definitely appreciate that, having one person serve and then, cooking outside. That's actually perfect for our family because my brother-in-law, Marissa's husband, is the expert griller, smoker, and he just revels in being able to cook outside. So I think that certainly fits us to a T.
Yeah, and we've actually had in past years, since we've been hosting the last couple of years, family bring food because my husband's not a big turkey guy, so he grills other things. And I think this year we may just have to forego the turkey, which, is all right if he's able to grill other meats and foods. But it's just interesting, how you have to kind of pivot and adapt. And if not having turkey is the worst thing that happens this year, I think we're going to be okay.
Absolutely.
Yeah. Yeah, we had talked about even with our family, because we do have two sets of my brothers that are coming in from out of town. And so talking through even when to get tested and giving some space and time to get those results if you're doing rapid testing or if you're taking a couple days to do the testing. But we had decided we're going to smoke the turkey, we're going to sit outside and social distance, having masks on inside, even just that reminder that when we go inside that we keep our masks on, and when possible, even still outside, keeping your masks on. We actually, that's our situation, is we are going to bring my mother-in-law in. And so since she's older, that was one of the things that we asked. And, just a couple of our family members just asked, like, can everybody get tested and make sure? And then we talked about what happens if somebody can't get tested. In fact, one of the things that we're going to do this year, you were talking about keeping it small, is one of my brothers, unfortunately, is not going to be able to come, with Chicago kind of recommending not traveling. They decided to respect those wishes. And so we're going to Zoom them in, and we're going to be able to set up, we're kind of talking through how do we Zoom them in for a couple different activities that we had decided to do in our, just our immediate family. For Thanksgiving, we were going to do a sibling gift exchange and just making sure that they still are part of the process, even though they won't be here in person. So,
yeah, that's great.
Go ahead, Dr. Steinberg. What would you like to
I just wanted to say something about the testing, because not everybody's going to be able to get tested, and I don't want everybody to think that that's what they have to do. It's a great idea if you can, but also we're about a week and a half, a little less than that, away from Thanksgiving, and what you can do is minimize your risk right now. Don't go out extra if you don't have to this weekend. Don't make that extra play date or go shopping if you don't have to. Maybe use this next week kind of to prepare at home, minimize your exposures right now to help prevent extra exposures during that actual day of Thanksgiving. So much. My family actually is not, I'm a healthcare worker, my husband's a healthcare worker, and our family who we're supposed to usually do Thanksgiving with, they're both healthcare workers. There's no way that we could all minimize our risks the day before or get tested and it be truly effective, because it will be, we're still going to be exposed continuously. So we're not going to be together this year, even though they live about 20 minutes away. And actually, this year, my daughter needed to get an elective surgical procedure done, very small. She's going to be fine. But we actually plan to have it done since she's off from school this week. So I think a lot of people will just do unconventional things this year, and that's okay.
Yeah. very much so.
And would you suggest people obviously continue what we're suggesting into the Christmas holidays, into the Jewish holidays? You know, just keep in mind that as these cases are rising, I mean, just a couple of days ago, you know, the state reported 10,000 plus cases. That's the most in several months.
Yeah.
So should people just, I know we talked about pandemic fatigue a little bit, but should people just keep in mind that this, for 2020, this is how it's going to be for the foreseeable future?
Yeah.
Mm-hmm.
There's going to be situations where people who are low risk individuals need to travel and need to go by air even, despite concerns. I think the best thing is just minimizing your risk wherever you are. If you're able to drive and not use a plane, that might be safer. If you are in the airport, wearing the mask and complying with their recommendations. And also respecting that, similarly to what Monica said about her her family member was, they recommend their state recommended not to travel right now, so don't. Florida's are a little different, but respecting where you're coming from and where you're going and how that affects your travel plans.
Mm-hmm. Yeah.
But people need to adapt, but also be safe. I think it's best to think that you need to, if you're working with another family member, is to respect the person who's most fearful in the situation and respect that, and the safest person. It's probably safer to go with the safest, most scared person than to go with the least scared person. So that's usually my approach. We're a healthy family, thank goodness, but so we do a little more things than other people would because we have a low risk family household. But that's not the same for everybody. So you have to, I believe, go with what the person who's most fearful, most scared, most immunocompromised, that's who you go with the recommendation when working with family members.
Thanks, Dr. Steinberg. And that's where like striking that balance comes in, right? Because you have all these different levels of comfort, different levels of vulnerability, even in the same family, right? And Monica, I know you've obviously dealt with some of that when you're talking about your brothers and whether to have family come in from Chicago or not. So is this something where, you know, we just need to like, okay, how safe does grandma feel, or how safe, you know, like how do you kind of get your family on board together with that, would you suggest, Monica?
Well, and I think that goes back to a couple of those things we were talking about at the beginning, having those kind of pre-Thanksgiving phone calls, discussing what everybody's comfortable with, what levels of risk are, where are they coming from. You know, I agree, like if you can minimize just being out over the next week, that's really helpful because it's going to minimize your risk of exposure, especially if you are planning to get together. But it goes back to also just being that self-awareness, allowing for yourself to really recognize what's going on in your gut. Maybe the struggle is that you're feeling really strongly about whatever it is, getting together, not getting together, either, you know, or somewhere in between, but just understanding where that's coming from. Maybe it is kind of that pandemic fatigue that's pushing you to feel like, oh, we just all have to get together, just kind of like wipe out what's going on. You know, we'll just keep our masks on, wipe down surfaces, wash our hands, and it'll all be okay. But you may have family members who aren't there yet. They're struggling, or they're high risk, or they're just not ready to break that pandemic, you know, isolation yet. And being able to step back and say, well, I might be feeling this way, but this other person may not be feeling this way. And I need to respect that about them. You know, my best friend back at Easter, because Easter's a huge holiday for my family. And I had texted her, she's in, you know, the medical profession. And I just said, like, is it okay if we sit outside and eat Easter lunch together? And, you know, her response really just brought some, it was just really helpful for me, because she said, it's probably going to be 1, maybe 2 years of Easters. And you would rather be safe and be able to spend the rest of Easters with your family than to possibly spread it and maybe lose one of those people if something, you know, did go wrong with COVID. And it was just a humbling reminder to me that it's not about what I want and what I feel like I need, but it's also about thinking about my family members, and is my pushing to be able to not wear masks or to be in person possibly putting them at risk, even if I don't feel like that's a high likelihood. And so once again, it's putting yourself in other people's shoes. It's being understanding of yourself. It's understanding where just where your thinking patterns at. So.
Well, and one thing I found in my family is we have, obviously people on different sides. For example, my father-in-law and his wife, they had somebody come down with COVID in another state, another family member on the other side of the family. But they were so affected by it that they told me yesterday, we're not coming for Thanksgiving, just because they don't feel comfortable, which, hurts a little bit, because that's immediate family. That's my husband's father. So, but at the same time, I think to myself, I have to respect their decisions. I'm not going to push them to change their minds if obviously this is making such an impression on them. And then at the same time, I'm also receiving, text messages from friends who are coming back to visit their families from out of state, who are telling me, oh, we're coming to your house for Thanksgiving. And so I'm kind of in this, middle area of trying to get over not being able to see some family, but then at the same time, how do I, have this discussion about, is it safe to have people from another state, coming in here, even if the cases are more here, is it safe for them, to come into our house? So I know that, you've given us amazing advice about having these conversations beforehand, which I'm starting to think, Julia, maybe we need to get everybody on a Zoom call to really discuss this, because that's genius. I don't know why I didn't think of that myself. But if you can kind of talk to me about, and talk to people about, how do you try to have that discussion with somebody who may be inviting themselves over and you want to see them? Of course, any other scenario, I'd be excited to have them, but how do you tell them that maybe not this year?
Well, and once again, using I statements is really important. So I feel I need, not blaming statements is really important when we have these conversations. Using reflective listening, like being able to reflect back to the person that you're talking with what you're hearing them say, because so often our miscommunication happens because we're already thinking 3 steps ahead of what we want to say to the person, and we've missed what they've said. And so I think it's important for us just to be present in our conversation, taking, deep breaths if we need to, being aware, like I said, of kind of our gut and our thinking patterns, and then being reflective. What are they saying back to us? Using, our I statements and being okay with it. I think at the end of the day, we're so, especially with social media and how do we present ourselves to people, we're so worried about what other people think. And I think it's okay for us just to say, it doesn't really matter. At the end of the day, down the road, I hate to say it this way, but when you're on your deathbed, in this moment, will this conversation affect the rest of your life? I mean, it may, but it may not. And being able to say, if I'm keeping my family safe and my gut is not this year, I really want to see you, but maybe next year, or maybe in a couple months when it's a little safer, then don't be afraid to say that. It's okay to protect your family. It's okay to protect yourself. We just do it with a lot of love and kindness. We talk about, I know in the teaching profession, my friends always tell me you do that sandwich, the cookie sandwich of like a positive and then the statement and then a positive. And so, I'm so excited that you want to come and visit me, but I'm really just feeling like this is not a good timing this year. We really are trying to protect our family. We've got X, Y, and Z going on, if you don't want to throw that in, but I really appreciate the fact that you care enough to let me know that you want to come and visit. And that helps because it's a softer landing of that statement.
Mm-hmm. No, I love that. Thank you so much.
Yes,
That's
I'm
great.
taking notes over here.
For
I don't know if you can tell, but I am taking notes from both of you.
Yeah.
So, I just wanted to bring up, and, thinking about, Dr. Steinberg, you were saying how the holiday is going to look so different this year. And I think about just how some of the some things are going to be different. Like the Macy's Day Parade, right?
Mhm.
That's not even going to happen in person. I mean, you can still watch the Macy's Day Parade, but you're not allowed to gather. Right. So there's that, which of course you can safely watch at home. Right. You won't have the crowds expected, but really looking at changing some traditions, Dr. Steinberg, or adjusting.
Yeah, I think it's definitely a time to start kind of going within and doing all the things that we're supposed to do during Thanksgiving also, and maybe making that the true focus instead of the food, but the gratitude, and also reaching out to local food pantries and Meals on Wheels, reaching out into the community in other ways, unconventional ways that you could help provide, or donating the money that you would have spent on a big gathering towards something else, and also letting the kids be involved in that as well, understanding gratitude, going over the history of Thanksgiving, and it's really big educational time to go over. I chuckled a little bit at the Thanksgiving Day. On the CDC website, they've mentioned that they said, "Oh, you can watch the parade." I'm like, "Oh, that's interesting. I wonder what that's really going to look like this year." I actually haven't done. I did see I think it was yesterday, the Rockefeller tree was going up, and everybody really, that was a nice social media awareness of everybody was talking about it and getting excited. And I noticed a lot of people putting up their decorations this year much earlier than usual. My family doesn't celebrate Christmas, but the joy in seeing everybody getting excited about it is great. And these are all things that you do inside your home anyway. So I think focusing on those things does matter, and should be the focus. And also, I believe there's football on Thanksgiving that you'll be able to see. So maybe this year everybody will be watching more football.
Yeah, I think that'll definitely be popular in our household. The other thing, though, that I'm really going to miss, my family has started this little tradition, just my husband, my son, and I, maybe one day, the baby in my belly, I don't know, but the turkey trot. Like, we have done that. I mean, I've run the turkey trot at Tropical Park in Miami-Dade County. I've run it pregnant. Not like super duper pregnant, but pregnant. And so that, was just something I loved. I would get up early Thursday morning with my husband. We would take our little son, he's 2 years old. This is going to be his third Thanksgiving. He's had his first two Thanksgivings began this way. My brother was in town for both the past 2 years, and our brother's not coming to town too. So there's a little bit, I would say, of kind of mourning those traditions, and maybe there's, and how to deal with that. Monica, maybe you could speak to that a little bit.
Well, the funny thing is I was just going to bring up the turkey trot as a new tradition because it's virtual this year. So, because I do it too. And I really, one of the things I really love about what they did this year is if you go and sign up, there's two options. You can do I think it's like, if you want to do the 5K, you can do the 5K, but there's also like a whole list of gratitude and just giving to other activities. And you can still access that calendar if you also just want to run, the 5K. But, for us, one of the things I was suggesting to our family is, even though we won't run it together, like, hey, let's all get up, or, at some point during the day, we can run, the 5K at some level together, or walk it if you're not really into running. And that's a new tradition that you can do. But grieving is hard. And I think allowing space for that is really important. There's a couple things that I would say about that. And one is allowing for you to kind of start thinking about those traditions now that may not happen, that may need to just kind of be put on the shelf this year, or may actually end up going away for good. And allowing for the space to just process that. Once again, talking to a friend, journaling about it, just taking a walk and thinking about that. Crying about it. Sometimes we need to cry, or we need to feel angry about it, and that's really okay. But giving us the space ahead of time to do that. On the day of, there's going to be things that we didn't even think about. Once again, if we're doing what most people are recommending with using, disposable utensils and plates and things like that, maybe you're used to setting a beautiful Thanksgiving table, and maybe you're not going to do that, especially if you're sitting outside, and that may not hit until the actual day of. And I think that's allowing for that space again to happen, where you're able to notice that, you're able to feel sad or angry about it, talk to the people around you. And that also is an opportunity for those of us who are with people who are kind of grieving some of those traditions to be understanding and empathetic, to show care and concern, not getting frustrated, because I think that's going to be a really big struggle on the actual day for people who, whether you're present or not present, you might be on Zoom or you might be getting text messages or phone calls about it. But sometimes we're dealing with our own stuff, and it feels really irritating to start to hear about other people dealing with their own stuff. And so once again, taking that moment now to start self-caring, so there's a little bit more space for you to care for others on that day. And then recognizing, even if you haven't done that self-care ahead of time, or you're getting flooded with emotions on that day, that it's okay to say that, gosh, I'm hearing you, and I'm seeing that this is really hard for you, and here's where I'm, at, and I'm feeling like this is really hard, and just allowing for that space on everybody, for that space for everybody to have. And once again, maybe that's part of the phone call that you guys do ahead of time, or the email chain, or the text message group chat. It's just, hey, we're all going to have things that we struggle with this day. And we just want to be able to state that now, and state that we really want everybody to feel safe to be able to talk about it and to be able to share, and that we're all going to be supportive as best we can. We talked about this kind of last year, of just that idea of even just taking a walk outside, getting some fresh air. And so if you're feeling on that day super overwhelmed because you're grieving something that maybe you really didn't remember that you were going to grieve, or just that things are still coming up, family's not there that you really wish were there, go take a walk outside for a minute. Just excuse yourself. Once again, it's not about how you present to other people. It's about self-care, and just saying, I'll be right back. I just need to take a minute outside. Or if you're the person who's kind of getting bombarded with everybody else's stuff, is just to say, let me take a moment, just go walk around outside for 5 or 10 minutes. It's amazing what some fresh air and walking will do to our minds and our bodies, and calming ourselves down and giving us the space to actually be present in our responses. And for those of us who end up responding negatively, it's about noticing it as soon as you can, and apologizing, and once again, doing what you need to calm down. The other side of grief, though, is allowing for some space for those new traditions. So once again, the virtual turkey trot, maybe you do get up super early in the morning on Thursday and do it, but maybe it's actually an afternoon turkey trot where you actually do trot it out after the Thanksgiving meal, and that's a new tradition, and you're able to process the food or something like that. I don't know. But the gratitude, I love that this year we really do need to really spend some time in that. So maybe there's some new traditions about with the kids or with the family as a whole on just talking about gratitude. Maybe it is that as a whole, as a family, that you guys are doing some service projects in the community, whether it's donating money to allow for other people to serve, or whether it's actually going, if there's a safe way to do it, and serving other people around the Thanksgiving holidays.
I wanted to echo something again, Monica. I love hearing everything you have to say, but I wanted to relate it to pediatrics as well, in that we always get caught up in how we're feeling, and I love that you saying check in with ourselves so we can be supportive to others. That's so important. But also for kids, they may not look like they're frustrated. They may get a lot of energy, or they may start biting their nails, or they may pick out something, that sleeping may be disrupted, or they pick up a new habit. I think for kids, sometimes that stress can manifest in a lot of different ways. And it may catch us off guard, where we're so focused as adults in our lives and taking care of everything that needs to be taken care of and calling family. And then the kids are watching us, but on the day of, we kind of neglected to kind of prepare them as well for these new traditions. So checking in with your children as well, and explaining what's going to happen, maybe even explaining we're going to do a Zoom call, because it's very likely that those children are not going to be excited for the Zoom call at the exact moment that you want. So checking in with the kids as well, and getting them excited for the day, whatever that is. Maybe they're going to get all the paper plates together and put them in a pile and bring them outside. But giving the kids responsibilities, even the 2-year-olds, the 17-year-olds, giving everybody responsibilities for that day of, to make them feel included and not catch them off guard, and feel the stress that you're feeling as an adult, and giving them that same kind of space to, okay, let's take a moment. And I think even with my 5-year-old son, my husband and I, after the kids went to bed one night, we kind of brainstormed how we're going to manage the next time he has a tantrum, or the next time he cries. How are we going to communicate with each other when he's having a tantrum? Because what ends up happening sometimes, which is very common, is there's parenting different ideas, and then I think what's best for the child is not what my husband thinks is best for the child. So that taking the time to brainstorm how we're going to handle a child's misbehavior in that moment, but a plan ahead of time is very important, and especially important for a stressful holiday, even if it's not 30 people in the house and it's only 5. But if you're having the Zooms and you're making phone calls and you're dropping off food at somebody's house, including the kids, and having a plan with your partner, how you're going to handle any mishaps that may happen.
Well, and I think that on just piggybacking on that, because that's excellent, is also noticing what you guys need and when to tag out. So if you are starting to feel a lot of emotions and stress from the day, it's being able to have either a safe word or like a pat on the shoulder or something, or just saying straight up to your partner, like, I just need a moment, because that's where also as parents, we don't always handle these situations really well, because our kids, they're feeling the stress and maybe they're acting out or they're upset or they're just off, because once again, it's not the normal thing. And then we're feeling off. And then that's where we start to butt heads with our kids, where if we can notice and be able to tag out and have that plan ahead of time, it does allow us, once again, to take that moment to calm down really quickly and then be present again for our kids in a really healthy manner. And that's a great role model for our kids to see, even just like, hey, I'm taking a moment and that's okay. And our kids learn then that they can take moments as needed too.
Yeah. And both of you, just thank you for that reminder that the kids are watching. I forget about that. And for my sister and me, our kids are really little. Ellie just turned 3, her daughter. And Luke is 7 months. And then my son is 2.5. And my goodness, I'm due December 6th. But even the littlest ones, they are watching and they're paying attention, and they're catching on. So thank you both for that.
Yeah, it's such an important reminder that, like you said, well, both of you have said, right, it's not just about us. We have to include our kids because they feel whatever we're feeling. And you forget about that because you're just trying to handle yourself, right, and behave yourself. But I see that, no question, my daughter's so quick and she's picking things up. So to be able to, like you said, include her in putting something as small as setting out the table, or getting her ready so many days ahead of time that we're doing things different this year, which we kind of even had to do with Halloween, right? Not going up to doors to knock on the door for candy, which after last year I was like, oh my gosh, we have to wait a whole nother year before she gets to do this again. I'm in trouble. And then of course we couldn't celebrate like last year, but we were able to to navigate that, thank God.
And that's
it is so important. Sorry,
it's another reminder also for like the little ones, even the older ones though, they don't have the same memories we have of so many years of there being a tradition. A 2 or a 3-year-old is just creating memories. They may wonder why years to come, why we're not doing Thanksgiving like this year. This may be their first memories of Thanksgiving. So who's it to us to say that they're being taken away? It's taken away from us, but for them, it's very exciting, and for whatever it is. So, keep in mind that their memories are not our memories, and they're creating their own new memories. So that's really inspiring, and I'm always optimistic and looking at it through. Everyone's worried about the children, but they're going to, they can thrive in pandemic, in this environment, if we let them.
Yeah, that's so true. Sorry, Monica, was there something else you wanted to?
I was just going to say that actually goes with setting good expectations too for the day. When we go in having really high expectations of how we want our kids to experience the holiday, how we want to experience it, how we want family members or friends or whoever, that's usually when we do experience a lot of disappointment and anger and sadness and grief and things like that. And so really setting our expectations at a really realistic point is, I totally agree. It's incredibly helpful. Our kids are going to thrive, and we're going to have a better holiday because of it.
So one other thing I wanted to bring up that kind of came up in the comments was another viewer saying that her husband's daughter is planning to drive over from Texas, and she's not sure about her staying with them. I know that we've talked a lot about how to handle these conversations, but what if you and your partner aren't even necessarily on the same page because it's their child? how should she handle this? I imagine you're going to say bring this up in conversation, but I know that's more easily said than done. So obviously this seems to be the big sticking point, right? As we're heading into the holidays, is how do you tell somebody that maybe you're not comfortable with them visiting?
I think, yeah, you could go. I have something to say for it also, but you could go.
No, you can go ahead and go first. Let's see, because I'm curious from the medical side how you would handle it.
From a medical, I think that's the best way to approach it. Actually, is from medical point, and also getting the facts of how she's doing it, what exposure she's going to have on her way. If she was quarantining for 2 weeks and then in the car for by herself and didn't stop anywhere, except when she stopped, she was wearing a mask and she took all these precautions, it would be less risky if she went to some sort of gathering the day before. So I think it would really articulate what her risks are with the drive. It sounds like if she is choosing to drive, she is trying to minimize her risks, and then also coordinate that with what's going on in the family that she's visiting and what risks that they'll have, and kind of looking at what the safest way to do it would be, and then maybe choosing 2 or 3 options. Maybe the option is we're going to be all outside wearing masks, we'll have a preset plate of food, and we sit very far apart from each other. Maybe that would be okay with both families. So maybe making a list of options that are scientifically, medically safe for you, and what she expects also in her list, and then maybe 2 or 3 of those will match up. And if the safest thing is wearing a mask, outdoors, social distancing, kind of working with her on what she's willing to do. And even if it's for an hour, maybe that will be what it is. But both sides need to make a list of what they would want, and then that would be, but I would start with the medical aspects that are important to each family member.
Yeah. And I was going to say that's, once again, yes, the conversation I think is really important. And with that, maybe even having a pre-conversation of just saying, hey, can you think about the pros, the cons, why you feel like it's important, why you don't think it's important, and bring that together and have that conversation about what do I feel safe about, what do I not feel safe about, what are the compromises that we can have? Because even if she's staying with you, the idea of how are you guys going to keep the house clean? So are we wiping down surfaces after people touch it? Are we frequent hand washing? Are people wearing a mask in the house itself? Once again, if there is an actual risk of COVID exposure. I know one of my coworkers, her daughter lives by herself. And so she hasn't had exposure. She orders her food in. There's very minimal exposure. Let's just put it that way, for her to be able to come home. And she's going to be tested before, she does come home and things like that. But, it's just about having that conversation. It's about being able to listen and validate each other's sides. Once again, when we actually hear what the other person says and we validate what we heard, most of the time, those barriers that cause the conflict in the conversation start to diminish. And that's really helpful. And, the extreme thing would be is to seek like a mediator or a counselor to be able to talk with you through it if you really can't have that conversation safely together, or it's just not going anywhere. And so it might be a trusted friend, it might be a pastor or your priest, it might be a counselor who you just call in, you just say, hey, we just need somebody to mediate this conversation for us and kind of help us get to a place where we can feel comfortable about it.
Well, thank you so much for all the suggestions. I know that obviously mask wearing, washing our hands, staying 6 feet apart, we've been talking about that for months and months. People know those things, but I feel like for Julia and I, hearing you make suggestions like having one person serve the food, use paper plates so that there isn't that reusing and passing of things from one person to another. Those are the kinds of little things, that we can do that maybe people aren't thinking of. That I'm definitely going to use for any family gathering moving forward. Although environmentally it breaks my heart, but here we are. We have to do it. We have to do both. We have to do it. So those are certainly the takeaways for me. And probably, yes, to stay outside. Lord willing, we'll have good weather that day, and it'll be easy for us to do that. And we actually did do that last Thanksgiving, so that won't be as different for us down here in South Florida. I know people who live up north, it's not as easy for them to take that measure. But certainly thinking about all those little things, using paper plates, as I mentioned, we can certainly, those are easy things to do, right? We don't have to have deep, long conversations about those decisions. But is there anything else either one of you wants to mention that maybe we didn't bring up, just to tie this all up?
Yeah.
I just remember that if someone is being tested or they were tested recently, they don't have their results, or you have any symptoms, do not gather in sites. It does seem obvious, but if you do have COVID-19, do not attend any family gatherings during Thanksgiving, and be safe, make wise decisions on your time. And this Thanksgiving is going to be historic, and it's Thanksgiving 2020, and we're going to all have it in our memory banks in whatever shape or form. So try to be optimistic about what you can.
And I think, just creativity to the day, even, pre-setting out appetizers in creative ways, that one person that's touching the food, having creative new traditions that you can do as a family, just checking in with yourself throughout the day and even this next week, and starting now, having some of those safe or healthy habits, once again, isolating as you can as a family unit, but then also creating some new healthy habits. So maybe take up walking or running right now, making sure you're getting enough sleep over the next week and eating well, so that on the day you're not frazzled and stressed and carrying a bunch of emotions on top of just not feeling healthy yourself. So.
Right, and just imagine
thank you
how
both
much
so
sweeter
much.
next year will be, right, after we've gone through everything this year.
I know, and you all have really made me think. Okay, think about what I'm doing now and how can I, like you were saying, Dr. Steinberg, minimize my risk right now between now and the holiday beginning. And you're both right. I mean, this is going to be new traditions. It's going to be a new part of our story. I mean, I think back to our Thanksgiving last year, and we had this huge party at Marissa's house with a sing-along and so much family, and I'm really gonna miss that. But there are creative ways, like both of you are saying, that we can Zoom with them, and just do new things with our. We have a new family member too. That it's his first Thanksgiving. My nephew Luke, Marissa's son Lukey. So that's really great. So you know what, I'm focusing on what we're thankful for. So, yeah.
And health for sure. And obviously to stay healthy, it's to take all of these precautions. So thank you, both of you ladies, so much for being with us today. It's a wealth of knowledge, and really just so reassuring to know that we can still enjoy the holiday, but to make good decisions. So we appreciate all of your expertise.
Okay.
Yeah. And thinking about long term, right? Because we want to have lots more Thanksgivings beyond this one. So thank you for helping us just to keep that perspective, and that it's also that it's not about us. And actually, I'm going to ask Fabiana, can we bring Lukey over here real quick? We want to see our newest family member. The best part of 2020 for our family so far. And Dr. Steinberg, it's so cool what you were saying, because for this little guy, he doesn't know any different, right? For Thanksgiving, right, Lukey? So this is Luke. This is Marissa's son, my sweet nephew,
funny,
and
Julia,
he is 7 months old.
I know. I'm trying to make sense of this with your video.
I'm holding her baby. I'm holding her baby captive.
We do this every Tuesday, right? I drop my kids off at Julia.
Quick fun fact. My son Ethan sucks the same fingers as Lukey does on the same hand. It's just like I don't know, a bad family trait or something.
They must be related, right?
But, so thank you. I want to thank you both too for helping me get more excited about this Thanksgiving and what it's going to be like. Whatever it is, right? It's a part of our family story.
It is, yeah, for sure. It's here, and I mean, not to be Debbie Downer, but I mean, I don't know what next year Thanksgiving is going to look like. So It's a good idea to enjoy what we have and who we have around us, and we take it each step. So yeah,
And to be
and
thankful no matter what, right? That's the
beautiful.
reason for
Yeah.
the holiday. Monica, I see you
Yeah.
nodding your head. So
Yes.
I imagine that's top of mind for you.
Yeah. I mean, we actually know that the brain changes when we can be grateful. They've actually done research studies to show how it actually changes our brain structure. And so it's just so incredibly important to be counting our blessings and noticing the things that we're grateful for on a regular basis, not just this month, but to start to make it a habit if we don't already have it as a habit.
Mm-hmm.
Yeah, that's amazing.
Well, ladies, thank you both again. We just so appreciate your wisdom and your time. Monica Schneider, who's a licensed marriage and family therapist with Wellspring Counseling in Miami, and Dr. Elizabeth Steinberg, who is a board certified pediatrician with Broward Health. We just can't thank you enough, and we wish you both and your families a very safe, happy, and healthy Thanksgiving, and to all of our viewers too.
Yes, thank you everybody for joining us. Happy Thanksgiving. And
Happy
ladies, we hope to be talking with you again soon.
Great. Thank you.
Thanks everybody for watching Moms with the Mic.
Bye-bye.